In today's video, we're diving into a topic that affects millions but is often misunderstood: irritable bowel syndrome, or known as IBS. If you've ever experienced stomach discomfort, unpredictable bowel habits, or just felt that your gut isn't quite right, this video is for you. Stick around because we'll not only explain what IBS is but also share some surprising insights that might change the way you manage your symptoms. Did you know that a simple change in your daily routine could significantly alleviate IBS symptoms? We will share with you simple daily routine changes to relieve IBS symptoms that you can implement towards the end of the video. Let's start with the basics. Irritable bowel syndrome is a common disorder that affects the large intestine. It's a chronic condition that you'll need to manage long-term. But don't worry, with the right knowledge and tools, you can lead a comfortable and fulfilling life. What causes IBS? The exact cause isn't known, but several factors can play a role. These include muscle contractions in the intestine, nervous system abnormalities, inflammation in the intestines, severe infection, and changes in gut microbes. It's a complex interplay, and stress and certain foods can trigger symptoms. But stay tuned because we'll dive into the most common triggers later. One of the biggest myths about IBS is that it's just in your head. Keep watching the video. We'll debunk this myth and reveal the real science behind it. Debunking the myth: IBS is not just in your head. One of the biggest myths about IBS is that it's all in your head. This misconception can be harmful, leading people to believe that their symptoms aren't real or that they just need to think positively to feel better. Let's clear this up. IBS is a legitimate medical condition with physical symptoms. While stress and emotional factors can exacerbate IBS symptoms, they are not the cause. Research has shown that IBS is related to several physiological factors. Gut-brain axis. There is a strong connection between your brain and your gut, often referred to as the gut-brain axis. This communication pathway can affect your gut's function, and disruptions here can lead to IBS symptoms. Intestinal motility. People with IBS often have abnormal gastrointestinal motility, meaning their intestines move food too quickly or too slowly, causing diarrhea or constipation. Visceral hypersensitivity. Many individuals with IBS have a heightened sensitivity to pain in the digestive tract. This means that normal digestive processes can cause significant discomfort or pain. Inflammation. Low-grade inflammation in the intestines has been found in some people with IBS, contributing to the condition's symptoms. Microbiome imbalance. The gut microbiome, which consists of trillions of bacteria, plays a crucial role in digestive health. An imbalance in these bacteria can lead to IBS symptoms. By understanding that IBS involves real, physical changes in your body, it becomes clear that it's not just a psychological issue. Effective treatment requires addressing these physiological factors, not just mental health. Symptoms of IBS. How do you know if you have IBS? The symptoms can vary widely but often include abdominal pain or cramping. This is the most common symptom and often occurs in the lower abdomen. The pain can range from mild to severe and is usually relieved after a bowel movement. Bloating. Many people with IBS experience a sensation of fullness or swelling in the abdomen. This can be particularly uncomfortable and can fluctuate throughout the day. Gas. Excessive gas or flatulence is another common symptom. This can be embarrassing and uncomfortable, affecting your confidence and daily activities. Diarrhea. Frequent, loose, or watery stools are typical for some individuals with IBS, particularly those with IBS with diarrhea. Constipation. Conversely, others might experience IBS with constipation characterized by infrequent, hard, or lumpy stools that can be painful to pass. Alternating constipation and diarrhea. Some people with IBS experience alternating bouts of constipation and diarrhea, which can be unpredictable and distressing. Mucus in the stool. It's not uncommon to notice white mucus in the stool, which can be alarming but is generally harmless. Urgency. The sudden and uncontrollable need to have a bowel movement can disrupt daily life and cause anxiety about leaving home or being far from a bathroom. These symptoms can be intermittent, with periods of worsening and improvement. They can also vary in intensity from person to person. The emotional and psychological impact of living with IBS can be significant, leading to stress, anxiety, and even depression. How to diagnose IBS? Diagnosing IBS isn't straightforward. There's no specific test for it, so doctors typically diagnose it based on symptoms and by ruling out other conditions. Common tests include stool studies, blood tests, and colonoscopy. Your doctor will use the Rome criteria, a set of guidelines for diagnosing IBS, which consider factors like the duration and frequency of symptoms. How to treat IBS? Treatment for IBS focuses on relieving symptoms. This can include medications such as fiber supplements, laxatives, antidiarrheal drugs, and even antidepressants. But remember, the best treatment plan is tailored to your specific symptoms and needs. And there's more. Lifestyle changes can make a huge difference. We'll discuss these shortly. Relationship between diet and IBS. Diet plays a crucial role in managing IBS. Certain foods can trigger symptoms, so it's essential to identify and avoid these. Common triggers include dairy products, high-gas foods like beans and cabbage, and certain fruits. Keeping a food diary can help you pinpoint your triggers. And don't forget, a diet low in FODMAPs, specific types of carbs, can be highly effective. We'll share some practical, simple daily routine changes to alleviate IBS symptoms. Simple daily routine changes to alleviate IBS symptoms. Now, let's talk about some simple daily routine changes that could significantly alleviate IBS symptoms. Implementing these changes can make a big difference in managing your condition. Mindful eating. Eat smaller, more frequent meals instead of 3 large ones to prevent overloading your digestive system. Chew your food thoroughly and eat slowly to aid digestion and reduce symptoms like bloating and gas. Regular exercise. Engage in regular physical activities such as walking, cycling, or yoga. Exercise helps regulate bowel movements and reduces stress, which can trigger IBS symptoms. Adequate hydration. Drink plenty of water throughout the day to keep your digestive system functioning smoothly and prevent constipation. Consistent sleep schedule. Maintain a regular sleep schedule to ensure you get enough rest. Poor sleep can exacerbate IBS symptoms, so aim for 7 to 9 hours of sleep per night. Stress management. Incorporate stress-reducing activities into your daily routine, such as deep breathing exercises, meditation, or mindfulness practices. Managing stress can significantly reduce the frequency and severity of IBS symptoms. Dietary adjustments. Follow a low FODMAP diet to reduce symptoms like bloating and gas. Identify and avoid specific food triggers that worsen your symptoms by keeping a food diary. By making these simple changes to your daily routine, you can take control of your IBS symptoms and improve your quality of life. If you found this video helpful, please give it a thumbs up and subscribe to Health Fox for more health tips and advice. Have you experienced IBS symptoms? What strategies have worked for you? Share your thoughts and experiences in the comments below. Your insights could help others in the community. And don't forget to hit the notification bell so you never miss an update. Thanks for watching.